It was published in the Journal of Children in 2019 by Tiffany Field. And so this was like a meta-analysis. It was another combination of pediatric data on massage from the past decade. So it was very interesting. Many studies showed really good positive effects for many different conditions and many different stages of life. So it really shows that it can help you, massage can help you, whether you're young or old, whether you're healthy or sick. And also the great thing about it is that it really showed that the massage helps the massager as well as the subject who's being massaged. So they showed the studies ranged in this meta-analysis from psychological problems, gastrointestinal problems, syndromes including burns, like really bad chronic burns, and sickle cell, and also for muscle tone and movement disorders, and for other chronic illnesses. So I'll just go over a few of them, the highlights here. Well, more than a few. I'll try to get all the good stuff. For preterm infants, we already know massage therapy is great. It's been researched for decades. There's more studies on preterm than full-term infants just because they're hospitalized less. Another thing that I thought was so cool is study after study that they looked at, most of them were only the 15-20-minute massages once or twice a week for 1 month long, and they were still able to see all these results in just that short amount of time. So very, very cool. So better developmental scores for preterm newborns exposed to cocaine and HIV in utero, significantly, and these are huge. I mean, the weight gain is something that has been showed time and time again. The shorter hospital stays, shorter infections for any type of, infant that is premature or has any kind of problems basically at all, almost, it seems like. That's probably an overstatement, but developmental gains are increased. There's always reduction, or a lot of times there's a reduction of parent stress, just better outcomes across the board. I mentioned earlier about MCT oil resulted in at least one of these studies in significantly greater weight gain for the preterm infants. Also, the temperature, you would think that opening up those little, whatever they're called, they're not called intubators anymore, but opening those up, you would think that you would get a lot of air in there, and it wouldn't keep the infant as warm, especially is a big concern when they're premature. But that was not shown to be the case. It kind of, the movement and the warmth of the parent tends to kind of, I guess, work to keep the temperature up, actually higher than those who were not receiving massages. For full-born newborns, it reduces the bilirubin levels, decreases sleep disturbances, colic, crying. There's better interactions between the parents or caregivers and the babies. The sleep is enhanced, circadian rhythms, longer periods of sleep, fewer night wakings, more total hours of sleep, mother sleep, parent sleep also improved. Again, reduction of parent stress, not just for the babies. It helps with kids on the spectrum of autism, they're more attentive at school, fewer sleep problems, ADHD symptoms improved. As we already know, constipation and diarrhea is improved. And again, like she said, way better than drugs. Reduces pain from many different causes, including like chronic conditions, chronic burns. There's less distress, less crying, less pain, less itching, and better heart rates and stuff as well, and respiration rates, and also range of motion improves. Helps kids with cerebral palsy, Down syndrome, and other motor development delays, asthma, cystic fibrosis, diabetes, eczema, children that have cancer and HIV. And there's various methods that were discussed in all of these studies. But the one thing that they kind of kept coming back to is this increased vagal activity for all that vagal nerve activity in the body. So very cool stuff, and just so far reaching. It's incredible. one and done.